As your local compounding pharmacist, a lot of times we have some neat tricks in our bag. We can help you resolve some of those tricky situations where a patient may be prescribed a triptan medication or even a long-standing medication to help with headaches and migraines. And maybe compliance is not there, or maybe their insurance doesn't cover it. Maybe it's too expensive for them to afford. And it might be months later or even years later before all of this is discovered. So compounded medications aren't necessarily expensive. Sometimes they're covered by insurance, sometimes not. It's hard to know that up front, but most of the time they're not as expensive as one might think. We can a lot of times put medications in a transdermal route, so literally a cream or a gel that is rubbed into the inner wrist or the back of the hand. This is very vascular. It's really easy to use, and sometimes that ease of use is something that a patient is really looking for. The other thing that we can do is help identify some of the root issues, some of the root causes. And even when we identify those, we can combine medications into one capsule, one sublingual troche that's easily dissolved and rapidly dissolved, or into a cream. Sometimes it's a matter of maybe we need enough vitamin D. So there's a lot of different ways that we can approach this. And what a compounding pharmacy can really do for you is to help solve those important issues, those long-standing concerns that you have with particular patients. Let us help you identify what is going to work best for that patient. Let's give it a shot. We're always happy to help. And a lot of times it's incredibly affordable as well.